Well, welcome to Connecting the Community. I'm Robin Reshard. What does MRSA, the common cold, and HIV have in common? On this edition of Connecting the Community, we'll delve into the topic of communicable diseases that affect the body's external environment as well as the body's internal conditions. What are these infections and bacteria that are attacking our bodies and affecting our physical and mental health? To what degree, if any, are we contributing to the growth of these so-called superbugs? Joining us in our studio is Dr. Barbara Wade with the Center for Prevention and Treatment of Infections. Dr. Wade serves as the Sacred Heart Hospital epidemiologist as well, and she's been involved in HIV care for over 20 years and incorporates HIV patient care in her practice. If you have a question for Dr. Wade on infectious health issues, we welcome your call to us at 484-1223 or 1-800-239-WSRE. Welcome, Dr. Wade. This promises to be an enlightening topic for our community tonight.
Thank you for inviting me.
Let's first sort of get the definition of staph infection, viral infection, fungal infection, and bacterial infection. Let's lay the groundwork for those first.
All of those terms, bacteria, viruses, fungus, fungi is plural, all refer to a variety of microorganisms. Infections are caused by a microorganism. So they can be caused by bacteria, viruses, fungi, parasites, probably many others. There's almost too many to name.
And in general, where do they originate?
The bacteria, the microorganisms, they're everywhere. They're all around us. We have a variety of microorganisms in and on our body that are protective and
all the time.
Beneficial all the time, totally normal. And they're in our environment, and they are beneficial in our environment. They're important in our soil for things to grow. They're important in water, and in all other living organisms.
So give me an example of a bacterial infection and a viral infection. Let's talk about the differences there.
Well, a common viral infection is a cold. Another common viral infection is, well, it's not common anymore, but measles. Everyone's heard of that, mumps. Those are viral infections. HIV is a viral infection. And viral hepatitis, A, B, and C are all viral infections. So they come in all types. Some are mild, some can be fatal, some you get over, and some viruses invade your body and then stay there forever. For instance, the chickenpox virus. Once you get chickenpox, that virus hides in the cells of your body and stays there.
And so we don't have some of those diseases, or we don't see as much as those diseases, chickenpox and measles and mumps. Why are we not seeing those infections as much now compared to some of the newer ones that we're going to get into?
We have vaccinations for those three that you just named, measles, mumps, and even now we have a vaccine for chickenpox. Was not available when I was a child, but now we do have that. So frequently those can be prevented. But not all viral infections can be prevented with vaccines just because of the nature of the virus. It might change, like HIV, for instance, changes so rapidly. By the time you make a vaccine to fight HIV, it's changed a bit and it wouldn't be effective. It also depends on how the body responds to the microorganism, whether an antibody is going to help or not. We have a multitude of ways that the body can fight off infection. One is a simple antibody, when we have cells that can do it. Our skin is part of our immune system, and that comes back up when we're talking about staph infection. Our skin is the first line of defense against infections from the outside.
And you're saying viral infections?
No, bacterial infections. Okay. Viral infections typically come in through the mucous membranes. So the nose or the mouth, the intestinal tract, or the sexual organs. But bacterial infections come in a whole variety of ways too. And the MRSA that's been in the news so much these days and is referred to as the superbug, although there's almost a superbug of every decade, but this is this decade's superbug, is through the skin most commonly. So the skin is very important. We need to keep our skin soft and supple, meaning not dry, flaky, or itchy, and we need to take good care of our skin. Lots of times people almost scrub too much, so they get raw and dry and itchy, and then that causes infections to occur, boils and abscesses.
So a bacterial example then is the staph infection, or
Yes.
this MRSA.
Yes.
And so why are we hearing about this MRSA now? You're saying that it is a superbug.
Well, that's what the media has named it, and that's fine. I mean, it makes it a little more scary than it maybe should be, but the good part is being in the media gets the word out to people of what they need to know and what they need to do.
Is there any reason to fear it?
There's a reason to fear it if you ignore it. I mean, certainly it can kill people who get very sick very quickly with it. Sometimes they have problems with their own immune system, or perhaps they haven't gone to medical care early enough. But there's a lot of myth out there too, and I see a lot of patients in my office who are so fearful. They've heard a lot, like we can never cure it, and that's not true. Once you have it, you'll always have it. That's not true. Or that you're going to die from it. Well, it does cause death sometimes, and I don't want to minimize that. But on the other hand, if we do the right thing in terms of taking care of our skin, getting problems taken care of early on, most of the time it doesn't cause death, and it can be eradicated. I mean, you can be cured.
So the difference between a normal, what you would see in your practice, a normal staph infection, or even under the microscope, and the MRSA is what?
The MRSA, MRSA, which we pronounce MRSA, stands for methicillin-resistant Staph aureus. And the bottom line is this particular strain, if you will, has developed mutations that allow it to survive around the old-fashioned antibiotics that we have typically used. So it's a little harder to treat. Maybe people have heard of the drug called Keflex. It used to kill staph. It killed all staph. Now it only kills about 30% of the staph that we see. So I see mild infections and I see severe infections with staph. And now we have to kind of plan on it being the resistant kind and start the antibiotics that we would need for the resistant strains right away, and not presume that it's the sensitive type.
So how would someone that, let's say that a person gets an infection, how do you know if it's a bacterial infection or a virus or a viral infection? And does it matter?
Well, it's hard to make broad generalizations like that. I mean, skin and what we call soft tissue infections, skin and muscle, abscesses and boils, those are bacteria. I don't know of any virus that causes a boil or an abscess. Now, there are some skin infections like herpes or shingles that are viral, but they're not boils or abscesses. So I think most infections that people come across commonly would be bacterial. A urinary tract infection is bacterial. Prostatitis is bacterial. So it's just really hard. There's so much out there to make broad generalizations about that.
We've been changing seasons here, and so we've been hearing a lot about this MRSA in this changing season. Are these infections seasonal?
No, they're not seasonal, and the term superbug is more appropriate. It really reflects the fact that it's come to public attention more now. This organism, this bacteria, this MRSA, we in healthcare have been aware of for decades, and we've had outbreaks for decades. And the answer is the same, and it hasn't really changed. It's cleanliness and hygiene. Now, that does not mean that if you get a MRSA infection, you're not clean. But what we do know is that in facilities where people are not able to use the best hygiene, or they're not aware that their practices are not good hygiene, they tend to get outbreaks of infection. We see it in prisons, And they don't get clean sheets and clean clothing every day in prisons. And they tell me that the housekeeping and even the personal habits of some of the prisoners are not what we would accept as appropriate. So they get outbreaks. In athletic situations on teams when they might use gear person to person and they might have the bacteria, one might have an infection or just be colonized, which means the bacteria are there but you're not having redness, pain, and fever. You know? They're passed person to person, and people share towels in athletic situations. Even in high school sports teams there have been outbreaks and linked to that. But the message is cleanliness. If you have a child in your home who has impetigo, you don't put 4 children in the bathtub together. You separate them. You use towels, individual towels, and if someone has a known infection, a boil or abscess you can see, you keep it covered. Take your bath, cover it with a bandage, see your doctor if it's severe, and don't share towels, and clean your bed linens and your towels frequently.
On any given television commercial in the Sunday paper insert, you see all of these advertisements for antibacterial soap and products and detergents and cleaning products and hair things. Are we cleaning ourselves to death?
Well, some of those products are very important, but there are some cases of cleaning ourselves to death. I have developed actually a skincare handout that is the fastest thing flying out of my office. We have it in all the exam rooms, and we just hand it out constantly because people are so fearful of this. They're using antibacterial soaps, and some people take 2 or 3 baths a day in hot water, and then the seasons change. It's drier now, and they get dry and itchy, and they come in with these infections all over them. And sometimes we have to treat the infection that's there, but then we can interrupt the cycle just by have them use emollient soaps. I don't use deodorant soaps. I use Dove. I recommend Dove. Gentle on your skin. Some people have more natural oils in their skin than others, so you kind of know if you tend to be dry and itchy. But people with sensitive skin or fair skin particularly have to be very careful of that. And I tell them don't use super hot water, just warm water, enough to be comfortable. Pat dry when you finish showering. Put lotion on after every shower before you get totally bone dry so you're not itchy. Because we talked about this a little earlier, about 1/3 of people, it shifts. It's not the same people all the time, but about 1/3 of people carry this organism in their nose at any one point in time. We all do this. We all touch. You know, we put it everywhere.
In a normal course.
In a normal course of activities. So if your skin is dry and itchy and you're doing this, you're going to get it in there. So we want to take care of the skin. So, and if most of the time in that case we don't get infections, even if we have the organism in our nose. So take care of your skin. I don't use those harsh things on your skin. On the other hand, lots of things in our environment that don't look dirty may have the bacteria on it if someone else has come by and touched it.
And of course the bacteria is microscopic, so then you can't
see it.
You can't see it.
One thing I do when people have repeated infections is tell them to get those pop-up disinfectant wipes and clean things that you don't ordinarily know to clean, like doorknobs, telephones, cell phones, computers, your TV remote, and things like that. Sometimes our pets can harbor these bacteria. In many cases, the human has given it to the pet. The pet's not sick, but then they keep it in their nose, and they get back and forth, and the human gets sick from it. Well, of course, scleroderma is not an infection, but it can change the skin, and anything that changes our skin from soft to normal can be a point of entry for infection.
So what is scleroderma?
Scleroderma is an autoimmune disease that causes a different kind of disease. And I mean, there's mild, there's severe, and everything in between. So it can be just skin changes, thickening, or redness, rashy areas, and it can cause severe problems with the esophagus. That's another.
Okay, and so to our point, what are some without seeing her?
I would say take your doctor's suggestions for care of the scleroderma, and then all the skincare comments that I just made would apply too. Be gentle on your skin, and don't try to overly cleanse it.
What if you do all these things? You're doing all the antibacterial soap, and are we doing a disservice to the good bacteria that you said that lives in our different body parts? Are we actually killing them as we do all of this antibacterial activity?
No, those antibacterial soaps are just on our surface, and there are times when they're important. Like if you're going to have surgery and your doctor tells you to wash with Hibiclens or some other special product before surgery, that's fine. But day to day, you don't need those. In fact, they remove the oils and the normal things from your skin that protects you. So I don't think those are a good idea.
I remember my mother using hydrogen peroxide every time we got a cut. She would dab some on with a Q-tip or with a cotton ball. Are there antibacterial products that are good for you that are not this sort of new age over-the-counter things? Are those old remedies still effective?
Well, when you have a cut or a scratch, it is important to first cleanse it. It's just plain soap and water. And then, depending on how big it is, you could apply some topical tincture of iodine. Peroxide is fine. It's not very powerful, is why we don't use it that much anymore. Any kind of a significant cut or scratch, an antibiotic, just over-the-counter triple antibiotic ointment is fine, and cover it, and then your body will heal it.
And alcohol and things like that, are those still?
If that's all, well, alcohol kills bacteria, and those alcohol hand disinfectants that we all get in every drugstore, all types of brands, colors and scents probably, are fine. They are good to disinfect your hands if you don't have another resource for that. We use them in the hospital considerably. Even after you wash your hands with soap and water, using that alcohol-based hand disinfectant decreases the number of bacteria on your hands.
And so how long will those stay on? How long will the alcohol or the peroxide or any of that stay on top to work for you?
Well, it works on what's there, and the next time you touch something, you've got it.
You have it again. So it's that constant war.
It is. Hand washing is the message. Keep, normal hygiene, like I like to think like our mothers taught us, and hand washing.
Okay. Thank you, Tony.
You are referring to Listeria monocytogenes, which can be found in food products, for instance, cheeses that might be improperly pasteurized. And there are a variety of illnesses that can occur when you ingest that bacteria. You can get fever, chills, and bloodstream infection. You can get meningitis from it. It can be carried in the female genital tract and has been known to cause meningitis in infants who are born of women who carry that.
Is it like a salmonella that he referred to? Which is a chicken-borne. I mean, that's what we mostly know of salmonella.
Salmonella is really common on chickens, undercooked chickens, and yes, it affects the gut. It can cause a bloodstream infection, but more commonly causes diarrhea, causes a diarrheal illness. So, except for the fact that it is a foodborne illness, I wouldn't really put them together too much.
Okay, all right. Okay, thank you, Danielle.
I'd be glad to. You're referring to a fairly new vaccine, which is fights human papillomavirus. This is a very common virus, and there are a lot of strains of it. Some of those strains cause what's called genital warts, and some strains cause cervical cancer. It is sexually transmitted. And now they have developed a vaccine that if it is given to the young woman prior to becoming infected with those viruses, she won't become infected with them, and she won't get cervical cancer. So it is recommended.
In the news, it's been that HPV virus vaccine has been pretty contentious because of the age that they're recommending. What's the reasoning behind giving it to teens and preteen girls?
Well, you need to give it before they have sexual activity at all, before they have any sexual contact.
So at this point, it's a guess when they will
Right.
have...
I mean, if you have an 18-year-old who's never had any sexual contacts, then give it to her. But just going by the statistics, sad as they are, they say that many young teenagers are starting to have sex, so that's why the recommendations. It doesn't hurt to give it early.
Does the virus occur in men as well? Obviously, cervical cancer doesn't, but does that virus occur in men?
Yes, it occurs in men, and it's transmitted from men to women and from men to men in the case of homosexual males or gay males. It can. I'm not a urologist, but I believe it can cause the genital warts in the urethra. But I don't know, could be, I just don't know about it causing cancer in the heterosexual male. It can cause, the same virus can cause rectal cancer in gay males.
So do you think then that it's going to be a vaccination sometime down the road, or is there one brewing up now in research facilities that are looking to be giving to men or young men?
I wouldn't be surprised, but vaccines, anything that we administer medically, it has to go through FDA approval. So that is based on studies that are done. And we got the big problems and then the lesser problems. And just by population and numbers, women with cervical cancer are greater, in greater numbers than gay males with rectal cancer. So it's in that group of females that the studies were done, young females, and it has been shown to prevent cervical cancer. It would make sense to me that it would probably prevent rectal cancer in gay males.
But the studies just haven't been done.
The studies haven't been done.
Okay, all right.
Well, the term cellulitis refers to redness, tenderness, and sometimes a little swelling in the skin. If it's just cellulitis, there's no opening. An ulcer is an opening in the skin. The several layers of skin and soft tissue are missing. Sometimes you can get cellulitis from an ulcer. There's an ulcer, maybe you got hit by a stick or something, took a chunk out, there's an ulcer, and then that got infected, you got cellulitis around there. Or in your case, you might have had the cellulitis, an ulcer developed. I just don't know. About, in our emergency room, about half the patients who come in with infections like that have the resistant kind. And about half the time, the Keflex would have worked, about half time it wouldn't. So did this ulcer occur in the middle of where you had the cellulitis?
We have her off the air
she's
now.
off, okay.
Yeah, we have her off.
So it's kind of hard to say.
Well, let's talk about her point about having to take the antibiotics and then a whole other course it sounded like she had to take. What's the danger in doing that sort of prolonged...
Well, the first thing to ask is, does she really have to take 2 months of antibiotics? That's pretty strange for an ulcer. I mean, usually an ulcer, I mean, depending on where it is, if it's on the bottom of the foot, you've got to quit walking on it. If it's somewhere else on the body, you've got to keep it clean, culture it, and you treat that infection. It shouldn't take 2 months. That doesn't make sense.
So that may be something then that she needs to go back and check with her primary physician.
Yeah.
Okay. Are younger children more susceptible to different infections because of their age as we wind down here, because of their age? We heard of the MRSA in the school setting. Is it just that close contact that we alluded to earlier?
Mostly it's the close contact. At the extremes of ages, the babies and very young infants, very young, I mean babies, and elderly people, as long as your immune system is intact, and like I said, that's the skin, and that's the proteins that build the antibodies, and that's all the different cells that are in the body, all the architecture of your lungs and sinuses and everything. As long as those are normal, you don't have some underlying disease like diabetes, for instance, is a handicap in fighting infections, then people in a broad range of ages are equally susceptible. It's the contact. Children in daycare again, the hygiene. You know, they
Okay.
just can't do the same thing that an adult can.